Hello everyone, I'm Dr. Lee Kwok Chung from Crest Surgical Practice. I'm a general surgeon specializing in colorectal surgery. Generally for colorectal cancer, the signs and symptoms depending on the area of the cancer. Usually common signs that we know are like change in the bowel habit, maybe blood in the stool, or very generic symptoms such as weight loss, poor appetite, the abdomen feel a bit more distended. However, in bigger group, which is the very early stage of the colorectal cancer, there is actually no symptoms. Patient can be completely normal until the cancer grows to a certain size, then give you the symptoms that I mentioned earlier on. Therefore, it's important to screen earlier before the cancer becomes too big. CEA is a biomarker which we take from the blood test, which is commonly used nowadays by labs and hospitals to check for in the way screen for cancer such as colon. However, it's a very non-specific type of test because there are many parts of the organs that secrete this CEA. Generally, you're talking about colon, that's one, two, stomach. It can be even like thyroid, breast. So secondly, it's very non-specific because if it's elevated, it doesn't mean that the person have cancer. One common group is smokers. Smokers are usually have a high CEA and actually do not have any cancer. And the other extreme, a normal CEA also doesn't mean that a person does not have cancer because there may be colorectal cancer, they are non-secreting of the CEA. That if you do a CEA markers, they will be normal. So do not take a normal as an absolute no cancer. So the best modality to screen for colorectal cancer is a colonoscopy. So a colonoscopy basically involves putting out a long tube with a camera at the end into the anus, to go all the way up to the rectum and the colon to detect one, to make sure that there is no cancer, and secondly, to see is there any polyps. If we see polyps, we can immediately remove the polyps and prevent it from growing bigger and turn cancerous. So that's in a way the best way to screen and can prevent colorectal cancer from developing. Broadly speaking, we divide treatment of colorectal cancer into either surgery, chemotherapy, or radiotherapy. But broadly speaking, for early cancers, the main aim is achieved through surgical intervention by removing the part of the cancer and also the surrounding lymph nodes. For more advanced cancer, sometimes we need to complement this with either chemotherapy or radiotherapy as a comprehensive treatment. Broadly speaking, nowadays we do colorectal surgery by keyhole or laparoscopic surgery instead of big open cut traditionally, which we've done. On the other hand, we also nowadays do robotic surgery, which in a sense also a laparoscopic surgery, but the arms of the robot is controlled by the surgeon, which a main advantage is give us more precision, very fine control, and very good 3D visualization. This is especially good for organs like rectum, deep in the pelvis, a very narrow area where we need very fine, precise movement. This is where the aim of the robot benefits comes in. Average the price for a major surgery like colon cancer can be range from around 45,000 to 65,000 on average. This means it's usually a keyhole surgery or laparoscopic surgery. If we do robotic surgery, usually the cost will be slightly more expensive because of the robot price. Patient on average stays in hospital range from around 4 days to 7 days, and by the time they go home, they should be able to go back to their normal daily function.